This episode is brought to you by my very first book, The Fifth Vital Sign: Master Your Cycles and Optimize Your Fertility. With over 1,000 research citations, it is the most comprehensive resource on fertility awareness and the menstrual cycle to date. The Fifth Vital Sign is available for purchase on Amazon in ebook and paperback formats. Audio is coming. And you can grab the first chapter for free over at fertilityfriday.com/vitalsign. That's fertilityfriday.com/vitalsign. This is the Fertility Friday podcast, episode number 255. Welcome to the 255th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. I've got a great episode for you today. In today's episode, I'm sharing my interview with Dr. Jolene Brighten, author of Beyond the Pill. And in today's episode, we get into her background and what drove her to jump into this work, and also, why her practice ended up focusing so heavily on birth control and kind of being outspoken on the dangers and ills of birth control. Now, for those of you who've been listening to the podcast for a while, you'll know that I'm also outspoken about birth control. And so we get into a lot of interesting points, from why medicine is, always pushing it, why it doesn't actually fix anything when it comes to women's health, but also questioning that notion that, if you question the pill, it's somehow anti-feminist or somehow going against feminism. It's almost, I think we're getting past that time. I feel like we're at a stage where, as women, we're starting to realize this connection between our menstrual cycle and our overall health and the effects of suppressing a perfectly normal and healthy function of the body, that is our menstrual cycles. But still, there's kind of this overall, idea that the pill played a central role in the sexual revolution and is central to feminism, and it represents all of these things. And so there's still that bit of, if you're questioning the pill, like, are you actually a feminist? But I think it's really helpful to get into the reasons why we question the pill, which is obviously what we do on the podcast all the time. So without further ado, let's jump into today's episode with Dr. Jolene Brighten. And today I'm very excited to welcome my guest, Dr. Jolene Brighten, to the show. Dr. Brighten is a functional medicine naturopathic medical doctor and the founder of Rubus Health, a women's medical clinic that specializes in women's hormones. She is recognized as the leading expert in post-birth control syndrome and the long-term side effects associated with hormonal contraceptives. Dr. Brighten is the author of Beyond the Pill, a 30-day plan to support women on birth control, help them transition off, and eliminate symptoms of post-birth control syndrome. She is a speaker, women's health advocate, and a medical advisor for one of the first data-driven apps to offer women personalized birth control recommendations. And in today's show, we're going to be talking about birth control and the effect of birth control on the menstrual cycle. So I'm really excited to welcome Dr. Brighten. So welcome to the show.
Hey there. Thanks so much for having me. And I think full disclosure for everyone is that you missed about 20 minutes of us chatting before we started this.
I know, we should have been recording, right?
I know. And it's something that, I just say that because we're going to end up referencing that conversation. I know it.
Oh, yes. No, we totally will be. Well, and, I think a lot of the audience members are familiar with your work, but I'm really curious as to how you kind of got your start and what inspired you to go into this field in general, in the beginning, but specifically what inspired you to then shift your focus and specialize in birth control particularly?
Yeah. Well, the funny thing is that I wasn't going to do anything with birth control when I started my private practice. We'll get there, because it's hilarious that I said that to my husband, and then he was like, yeah, a few months ago, he's like, you just wrote a book on it. So, I actually was, I was a sick kid. So I had a lot of digestive issues, and, at a very young age, I was really interested in medicine. I think once upon a time, probably a past life or something, I must have been a doctor or a healer or something, because no 6-year-old is really interested in anatomy books. And actually my child is. So that I feel like there's an influence there, but really interested in herbal medicine, started learning about that at a very young age. And as I got sick, and my doctors couldn't figure out what was going on with me, I got really interested in nutrition and just, getting sick and being sick for 10 years, I got to a place where my doctors couldn't figure out what was going on with me. So they decided that it was in my head, that I likely had an eating disorder or I was just wanting attention. And then came the discovery of H. pylori, a bacteria which was discovered to infect the stomach and cause gastritis and ulcerations, which I had. And what 10-year-old has gastritis? Like, that's not a normal thing. And so once, I went to another doctor at 17 and just being like, I can't live like this. Like, I'm so sick. I can't digest anything. I throw up after my meals. And he's like, I wonder, there's this thing called H. pylori I just read a study on. And I share this bit because I think this was a necessary part of my journey of understanding that people don't lie about their symptoms, especially when they keep seeking help. And that there has to be discovery, understanding, and a doctor has to actually read a study for them to know what to be investigating in you. So, with all of that and making the connection. So at, 17, they discovered I did have H. pylori, my second endoscopy. So second time, tube down the throat as a kid. And they found the bacteria. They treated me. I had a wonderful allergic reaction to amoxicillin. And then I had to get treated instead. I remember sitting on my bed. I'll never forget as a teenager and like scratching my head and being like, there's this huge bump. I had like huge welts all over my body. So I ended up having to go even longer with like antibiotic treatment. And when it got to the end of it, they said, well, you're going to be on a proton pump inhibitor for the rest of your life. Like, here you go. These things weren't over the counter at this time. They weren't ubiquitous like they are these days. And they had never been tested in children, let alone teenagers. So I thought that was very interesting. And at the time I was like, there's no way I'm going to pop a pill every day. And then I started birth control.
Because it's not really a medication though, right? None of us register that it's even a drug.
And at the time my doctor was like, hey, those painful periods and like, bleeding for 7+ days and like writhing in pain on the floor, that doesn't have to be your norm. Plus you can prevent pregnancy and like, this is a woman's right. Yay. And it is a woman's right. But I didn't get the full story then, but I didn't think anything of it. And I started like, I didn't want to be on that proton pump inhibitor. I started making correlations that like certain things I ate made things worse, refined carbs. And so I started shifting my diet. At this time, I was a dental assistant. So I actually became a dental assistant at 16. So whenever one of the top searches that we found on the internet is Dr. Jolene Brighten's age. And I said to my husband, like, why are people searching my age? Like, that feels so bizarre. And he's like, because when you say you've been in the medical and health and wellness arena for over 20 years, people are like, how old is she? I'm like, oh, yeah, because I became a dental assistant at 16. I left high school. I tested out early, went right into medicine and had my first, medical license at 18. Like, kind of bizarre, this journey I've been on. But, I did that and I worked in dentistry for 6 years until I finally decided to go back to school. And I had these awesome dentists I was working with. My childhood, I was told that I was never smart enough to go back to school or to go to college. I actually got the story of like, you should find a man with a good job to marry to take care of you. Yeah, it's funny because, and I haven't really shared that much, but I tell this bit because whenever people are like, oh, you must be anti-birth control, understand that like, this is where I came from. And I used birth control as a tool to be able to become a first generation college graduate. And I became a doctor. So like, would I do it differently? I couldn't say that because like, look at where I am. Like, this was a necessary step in the journey. So I went back to school and I started studying nutrition. And then I like got really into chemistry. So I got a degree in chemistry. Then I got a degree in nutritional biochemistry. And then it was at that point where I was doing graduate research work, actually in sarcopenic obesity and muscle mass, and that I found naturopathic medicine. And what I realized is that I had a really robust science background. And I was like, I have all of this science, but what I'm missing is the philosophy that really honors and respects the ability of the body to heal. At the time, I was working my way through grad school, teaching yoga. I was a meditation instructor. I had a nutrition practice. So when I found naturopathic medicine, it was like, and you can go deeper and you can learn how to use herbs to actually like support people's health. And, you're going to learn that alongside pharmacology because I was on track to get my PhD and then I was debating an MD PhD. And when I found naturopathic medicine, people thought like a lot of people thought I was insane. They're like, what are you doing like with your life? You're going to go get this degree. And like, it's like, you have all this science. Don't you know better? And I'm like, yeah, it's because I have all this science. They need a philosophy that works with the body and like just a different way of thinking about things. So that brought me to naturopathic medicine with the intention I would study gut health. And then that's what I was going to focus in, because that was my personal story and my personal journey. And thank goodness that's where I started, because that is, I mean, I took all these advanced classes in gastroenterology and then fertility as well. And, if anybody listening, like your gut is everything. So if someone's talking to you about your hormones, they should ask how you poop as well. That's a very important thing. So I'm in naturopathic medical school. I learn, probably like this is the third physiology class talking about the menstrual cycle, but we were seeing it through the lens of getting pregnant, like actually getting a woman pregnant, which seems to be the time that's when we all get the information that it's one day. You got one day out of the month that you are actually fertile. And this is something I've heard time and again from patients, is that like, I didn't even know how hard it was to get pregnant until I wanted to get pregnant. And I was had the fear in me my entire life that if like a man like even touched me, I would get pregnant. Like, and that's something that I think a lot, that's a little bit, I talk a lot about old stories, and I had the, privilege of hearing Charles Eisenstein speak many times and spending time with him. You guys, if you don't know who he is, go look him up. He talks a lot about stories. And when you start to frame these dialogues as stories, you can see that you can rewrite things, you can erase, you can go back, you can change that. And you can also understand why you butt heads with people and hold a little more grace for them. So I digress there. But so in this, I decide I'm going to stop birth control. So I'm like, I'm not sexually active right now. Like, why am I even on this? And it's just suppressing my hormones. And at that time, I stopped birth control. And for the first time in my life, I lose my period. And I lose my period. I develop cystic acne. And my doctor says to me, you probably had PCOS all along. I'm like, no, I'm learning about PCOS. And like, I had regular periods. He's like, you're misremembering. I'm like, no, wow. I counted it down like doomsday, because it's just, I was afraid of my period. Like from 14 to 17, I was terrified of my period. I mean, I would bleed through a tampon and a pad and like go right through my clothes. And that's, for everyone listening, that's called menorrhagia. You will learn about that in Beyond the Pill. That is not normal. It is very common and is very often dismissed. Like, oh, you have a heavy period, whatever. That's what it's like being a woman. No, that's not what it's like being a woman. Old story. So I developed post-birth control syndrome as I recognize it now. My doctor did a good job at making sure I knew I was a freak and the only one. So I thought I was. I didn't want to talk about it. I was really ashamed. I was ashamed of my face. And I decided, just having that experience and just really making the observation that women's medicine is often done to them, not with them. They're not an active participant. And having a gynecology instructor. So Dr. Carrie Jones was my fertility instructor, and wow. Dr. Kimberly Winstar was my gynecology instructor. And, they approached a gyne exam very differently. It was hand a woman a mirror so that she could see everything that was going on, that she was an active participant, that if like what was happening, she didn't want to happen anymore, then you stop the procedure and you try again another day. Like, we don't know what's going on for that woman. So just respect her voice in all of this. And that was very different than all of the gyne exams I had been experiencing for like the last decade. So having that observation, I decided to go into women's medicine. And at this time, I started rotations in a homeless youth clinic. And this is why I really would never advocate that we lose access to birth control. This is a high-risk population for sexual assault. They don't have doors to close at night. Like, it's a very scary thing for them. And so for 2 years, I did a lot of birth control counseling, passing out a lot of birth control, pills. Yes. Also lots of depot shots. And that was the time where it was like, oh, we knew that 2 years with depot, if you went past 2 years, you could lose bone. And we were telling women about that in this state-funded clinic. Yet I would go into a conventional medical practice, primary care doctor, and the story went, oh, you are going to college? Here's your pill. See you later. Oh, here, we can just give you the depot shot. There's no reason to get a period. Just keep going with the depot shot. And it was something that was really, I had these moments where I was like, why are we not talking about what's going on? So
just to kind of like, okay, so in the high risk clinic that you were working in, you were actively kind of advising women of the risks, the health risks associated. And then in the actual like doctor's office, none of this was happening.
Yeah. So in the clinic, there was the PAR-Q. That's what it's called in medicine, giving them the plan, the alternatives, making sure you go through the risk and answer all their questions. Whereas like in, the conventional medical practices, there was like no real discussion of the side effects taking place. naturopathic doctors don't tend to be high prescribers of birth control just by way of like in private practice, just by way that most women are coming to you wanting a different solution than birth control, or they're having fertility issues and they're coming off. So, in that, I got really fatigued after 2 years of talking about birth control, like every single week. I said to my husband, when I start my private practice, I'm done. Like, I don't want to talk about birth control anymore. I'm going to send him to the gynecologist. Like, it's so boring and it's so this and that. And then I got the reputation of being the doctor who believed women's birth control stories. And I'll never forget how bizarre the feeling was that people would call my office and say, I heard that Dr. Brighten believes women's birth control stories. I'd like to make an appointment. Like, what does that even mean? Believes women's birth control stories. And then after hours of conversations, I came to recognize that if you had a side effect with birth control, you were likely to be dismissed. So if you started having mood symptoms, gut symptoms, you had yeast vaginitis, they just kept treating you over and over for it. When you came off and developed post-birth control syndrome, you were likely to be told that this was something that you had all along, or, this is your normal or your new normal. I always like that. It was a lot of healing for me as well to realize that I wasn't the only one who struggled to break up with birth control. And I came to observe that the majority, if not all of women, have some issues breaking up with birth control if they're not really taking care of their health. And so as much as I didn't want to talk about birth control or have that part of my practice, it's something that really my patients kept bringing to me. And, I'm thankful that they did because they were my best teachers. I learned so much. And the protocols that you find in the book is what I learned from my clinical practice. So that's the long story of how I arrived here. You got the longer version today. I think you revved me up being chatty before.
Yes. Well, no, I really appreciate that. I mean, personally, part of the reason that I really love doing interviews is because it gives me the opportunity to just, what I really love is finding out what brought people into the profession. And I think that's helpful for the listeners because it reassures them that there are practitioners out there who have actually lived certain experiences similar to theirs and are genuinely concerned about these issues. And what you talked about, I want to dig a little bit into that because it really highlights this huge gaping hole between the way women are treated in most conventional doctors' offices versus what we actually need in order to be healthy. You went through your education program and came out on the other side questioning birth control and recognizing that it's not solving the issues and recognizing that it's suppressing hormones. But many medical doctors come out on the other end of medical school believing that the pill, they're taught specifically from my interviews with doctors, they're taught specifically that the pill, basically any menstrual issue that goes wrong, the pill is the solution. So maybe for the listeners who've had that experience kind of time and time again, maybe can you shed some light as to how doctors are educated differently? Because even the conversation that we're having now technically is controversial, as you know, right? Because we're questioning the pill. We are two women, two feminists who are questioning the pill. It's controversial from the feminist end. It's also controversial from the medical doctor's end because doctors heavily advocate for the birth control pill and other hormonal birth control options and don't really make the connection that there are actual serious negative scientifically proven side effects associated with it.
Mm-hmm. Yeah. And, I had a medical doctor who said something really interesting to me in a conversation, and he framed it like this. He said, when we go through residency, it's basically indoctrination. And whatever we are taught in residency is like the gospel. That is truth, always truth. Don't question it. And for doctors to change their minds, there has to be a lot of research evidence to make that shift and make that change. So understand, I want to say this because it's become trendy to kind of hate on medical doctors. And I just want to say, nobody goes through medical training and gives up a decade plus of their life if they don't really want to help people. And they do really want to help people, but we just have to understand that, they have a different education. They know what they know based on what they're educated on. And when it comes to root cause medicine, that's a different philosophy. So that's what I was talking about is it's a different philosophy and a different way of thinking. When it comes to acute care management, they're awesome at that. They have a very important role in our society. And you'll read that in Beyond the Pill where I'm talking about cardiovascular risk. And I'm who really rocks at this? Your conventional doctor, you need to see them. They're so good at identifying these things and, making sure that you're safe. So But with this, this really brings up the issue of medical gender bias, which is well recognized. I speak to it briefly in my book. As I started writing about it, I was like, oh, this is like a whole nother book to write about this. And there are people writing about it. Like there are books coming out about that. And there's studies coming out showing that we as women are more likely to receive inadequate care when it comes to complaints of pain. And so think about your endometriosis women. Like these are women who, when they're past the pill to fix their period problem, doing air quotes right now, there's not always a discussion about what might be going on, and it delays the diagnosis. That's really what I take big issue with, is it's a disservice to pass a woman birth control without discussing the why and what is going on. She has a right to know about her body. We also know that, women, to frame it, because there's some people who are like, eye roll, you're saying that there's medical gender bias, like that's not real. Well, it's documented that we die at higher rates of heart attacks than men because we're more likely to be sent home when we seek care and to be told things like you're anxious, it's in your head, it's not real. And that's because we present differently. And depending on when your doctor was trained, when I went through my training, I was told and taught that like women present differently. So if you have a woman in your office who's nauseous, has indigestion, and is sweating and has been complaining of fatigue, take her blood pressure, take her pulse, figure out what's going on. Whereas like 20 years ago, your doctor may not have gotten that training. And it's, and then it's a question of like, did they get their continuing medical education in specifically on that topic? Was it mentioned to them? Doctors are like really busy. There's a lot of studies coming out all the time. Like we can't stay on top of everything. So that's why we have, required continuing medical education. But there's this idea that, the pill, I call it the pill for every female ill. And, when this pill was designed, it was designed for young, healthy females to space pregnancies or delay pregnancies. And then it became, we saw the tides really turn. And this happened, really when I was young, when I was of age to, be offered birth control. That's when everything started to shift, and it became the one size fits all solution to any complaint that a woman had. And, if you're taught that the pill fixes hormones, then why wouldn't you use that? Why wouldn't you recommend it? Doctors are also taught it fixes a woman's period, and that pill bleed is a period, which, there's you, me, Laura Brighten, Nicole Jardim, like all of us out there talking about this, that like that pill bleed is not an actual period. You're not actually having a menstrual cycle. And that's a disservice to miseducate women in that way, to say, okay, you have irregular periods. Let me pass you the pill. Now you have regular cycles, you're having your period. Like it's confusing. It's why we're met with some resistance from women that are like, no, the pill did fix my period because I get my period every month. And it's like, oh, okay, we got to talk about the menstrual cycle. We got to go upstream of what's happening because and this is something I've had conversations with doctors, and they'll say to me, how can you say it doesn't fix their period? And I'm like, okay, how's it designed to work? It's designed to shut down the entire reproductive system, to stop it from working. If you had a drug that shut down the entire gastrointestinal tract, so somebody was like having gas and bloating and you just shut down the whole gut, would you say that fixed the gut? You wouldn't say that fixed the gut. Like the gut is now inoperable. So we have to, there's a lot of like miseducation for everybody. I mean, I was miseducated about the pill for a very long time. And we even see pushback on really simple things. So when I was getting my degree in nutritional biochemistry, I was concurrently studying clinical nutrition. So at one point I was like, maybe I'll go be a registered dietitian. And in those classes, they were like, hey, if a woman's on birth control, here's all the nutrients it depletes, and she needs to have like a multivitamin or prenatal. And I was probably like 5-6 years in on the pill and being like, wait, what? Like nobody told me about this. Like what's going on with this? And so, with that, I've had doctors push back on me and they'll say, why are you recommending a multivitamin or prenatal? And like some of them do recommend this because we know the pill depletes folate. That's really important if you get pregnant. And when you're taking a medication that's only 91% effective, like you might get pregnant. So this is like a really important thing. But there's others who are like multivitamins and prenatals, like, just offering those to people is like kind of a scam and they don't work. And I frame it to them like this, like if you gave a patient metformin, a diabetic drug, knowing it depletes B12, what would you recommend? Oh, I'd recommend B12. Right. Okay. If you give a patient a statin, knowing it depletes CoQ10, what would you advise? Oh, I would give CoQ10. So if you give a woman a pill that depletes magnesium, zinc, selenium, folate, B12, like the list keeps going, like what would you recommend? And that's the light bulb moment for them where they're like, oh, yeah, I should be recommending that like she takes this alongside that birth control pill because of those nutrient depletions. But, it's really just a matter of like, we need that level of education. Doctors have a lot to learn these days. And again, they're really focused on more of that acute care. And that's why, people ask like, why is the book called Beyond the Pill? Because I know you can always get that from your doctor for any female lady part problem that you have. Your doctor's going to give you that solution. I wanted to give you a solution beyond birth control, have you understand, that irregular period might be PCOS or it might be hypothyroidism, and the pill doesn't fix either of those. And like, if you want to take it for your symptoms, 100% you're right. But you should also know that like there's some other consequences that could come from that and ways to safeguard yourself and track your own data because you live in your body. And that's why, we were chatting before, like you're a fam educator. That is so important because you're going to notice the symptoms before any lab picks that up.
Mm-hmm. Well, I mean, this is a really important aspect of it because what I found in the work that I'm doing, I mean, here we are educating women about the menstrual cycle, why it's important beyond just your ability to have children, and how the birth control pill doesn't fix anything. But as women, when we have legitimate health issues, as you mentioned, endometriosis, thyroid disorders, PCOS, it's not necessarily something that we can fix on our own. It's just not. There's a kind of a misconception that I've seen where because it's a menstrual cycle issue, we assume that it must necessarily be fixable with like 2 supplements or whatever. But it's not like that.
That would be so nice. My goodness.
So women need medical care, right? We need medical care. And so this is the challenge. You have these women who've now learned about their menstrual cycle. They've now learned about the side effects of the pill. They go to their trusted physician. And their trusted physician is telling them, no, the pill is medical gaslighting. I think Nicole Jardim said that, and I've like clamped onto that because it's like,
no, there's studies
literally
that exact term.
So then how do we bridge the gap? Because what it feels like to me that we're kind of on the brink of something. I think we were talking about this in our pre-chat where it's like 20 years ago, people weren't really talking about this. But now, obviously, periods are getting their moment in the media and things like that. So you have a growing number of women who are now educated. But in this particular area, they are more educated about the side effects of the pill. They are more educated about the importance of their menstrual cycle and how it works than their physician. Their physician is more educated and knowledgeable about everything else because, as you mentioned, I mean, they did go to med school. And I always like to balance the conversation with like not to demonize doctors, but we need to understand where they're coming from. And that's like the really central aspect of all this. But you have women now going to their doctors with this newfound information. They're actually really excited. They're connected to their cycles for the first time often in their lives, only to have their doctor really not be able to help them. Because part of the whole like pill for every ill, if you take that away from the doctors, they're not equipped to address the root cause because that's not how they're trained. So this issue. Anyway, so I'm just kind of pointing out the issue and I'm curious to hear your take on all of that.
Yeah. So, that's something I aim to do in my book as well, is I go through the chapter of Take Back Your Period, which we were chatting that it was called the 5th vital sign. And my publishers who look out, they're solid at looking out for the readers. We're like, nobody knows what that is. And then your book came out at the same time. And I was like, oh, snap. Now everybody's going to know what it is. Like, it's on. Like, with that, I teach women like, so look, like heavy periods, for example, that's menorrhagia. Like, here's your checklist, like to know that this is not normal. Like, well, like your mom may have had it, your sister had it, your best friend had it. Like, it doesn't mean that it's normal. So here's your checklist. Now, with that, here's the lab testing that you should have done by your doctor. And here is what your doctor should be investigating. So you can go to your doctor and have a more educated discussion with them. And then I also give solutions of like, here's what you can do right now at home, because you're right. Like, we're seeing more and more that this is becoming commonplace conversation. And then women feel like they can fix themselves, and you can, but you usually need, a guide. That's what I call myself. I'm like a trail guide. Like, where I'm like, you've got to walk the path, but like, I've got to help show you the way, because it can be really, really complicated. And, the analogy I use is that, navigating your own health is like reading a book that's too close to your face. Like, you have all the information, but like, you can't read it. You need someone to stand back and help you. So in Beyond the Pill, I try to help you get a lot of clarity, and then also set you up so you can go to your doctor and say, like, I'm having heavy periods. Like, can I get tested for iron deficiency anemia? Like, could that perhaps be an issue? And like, should I be worried about fibroids? When you go to, like, we have to remember that doctors are people, and there are people out there advocating of like, your doctor works for you and tell them what to do. Don't do that to any human ever. Like, what happens when you go in and your guns a blazing and what do you do like when that's your spouse or your child or your friend? Like, people shut down. That's like a very common response. And so women will be frustrated. They're like, my doctor just like kind of shut down on me. And it's like, yeah, because if they have to go through that 10 times a day, the only way they can protect themselves in the work that they're doing is to not feel and to be like, okay, I have to shut down on this. And so we have to be empathetic for our practitioners as well, especially when you look at the statistics of the rate of physician suicide climbing every day. It's like, be nice to your doctors, because there's a lot going on behind the scenes. And, it's something that I think women get frustrated because they're like, my doctor's not hearing me. They're not listening. You have to also speak in their language. And it's so not fair. It's so not fair that you have to be not feeling well and then also have to go talk to your doctor in their language. But what I mean by that is that doctors operate in quantifiable data. So if you tell your doctor, I'm having heavy periods, they may ask follow-up questions. They may be behind in their schedule and they may be like, okay, you're having heavy periods. Like, here's a pill, or like, here's this. But if you're saying, I'm changing a tampon and a pad every hour the first 3 days of my period, and I have to wake up at night to change that as well, they're going to be like, whoa, okay, what did you just say to me? Like, that's going to give them pause. And so I really aim to do that in Beyond the Pill. But let's recognize that, like, another analogy I like to use is that, like, if you go to a sandwich shop and all you really want is ice cream, and you're asking for ice cream and you're begging that person for ice cream and you're getting angry and you want ice cream, like, you and that sandwich shop owner are going to get super frustrated with each other really fast. And it's not going to be, in anyone's favor, because you really need to go to the ice cream shop. And this is much like when we go to conventional doctors. So women will learn about this root cause medicine. They'll learn about these things and they'll say, I'm going to go to my gynecologist or my conventional doc, my PCP, my primary care physician, and I'm going to say, I want this root cause medicine. We just went to the sandwich shop and you asked for ice cream. And that's why we're going to get really, really frustrated, because they are really, really good at acute care triage. And like, if you need a medication, they can help with that. Like, if you need an antibiotic and you've got something acute going on. So acute means like short-term crisis happening in health. But if you've got something that's more chronic, like most period problems are, and you've got something that you want a root cause solution for, you need to go to a doctor who's trained in that philosophy. They're different philosophies. So it's not that your doctor's bad. It's not that your doctor's dumb. I've seen that as well. And I'm like, doctors are in the top 5% of intelligent people in the world, right? Your doctor's not dumb. They're just trained differently. Their paradigm is very different. They're very good at what they do. But what you're asking for, it doesn't match what they're able to provide. And so your doctor's not bad. You're not bad. Like, nobody's bad. Like, you just need to seek out different care. I mean, that's the other thing that happens is that when we get frustrated with our doctors, or our doctors start to tell the same story that they've been taught, which there's definitely dogma in medicine, we start looking at ourselves and being like, well, then I'm the broken one. Something's wrong with me. And same thing is like kind of a slippery slope, out in, on the internet as well, where people are meaning well to help people, but they'll say things like, oh, well, you can fix these, like, your problems in like 14 days. Like, you can clear your acne in a month. And like, maybe some people can, but that is something that's kind of dangerous to be saying, because it depends on where is that coming from. That individual's choices, their lifestyle factors. And why I say it's kind of dangerous is because I think it's damaging to our mental health when we read these things and then we're like, well, something's wrong with me because I couldn't fix myself and I couldn't do this all on my own, or, I couldn't clear my acne that quickly. So like, I'm doing something wrong. It's all me. Well, it may just be that like you need to partner with somebody, or for you, like the key that unlocks all of this is something totally different that this person doesn't know about. They're not sharing about that. And so, I just want to say that, like, it's very, very important that we be gentle with ourselves, because we have been trained and conditioned as women to always turn that finger around and point it right back at ourselves as if something's wrong with ourselves.
Mm-hmm. Well, and I just think it's really unfortunate that, the history of medicine, doing most of the research on men, the fact that, as you mentioned, women present differently for heart attack symptoms, and doctors weren't even trained in that until quite recently. Women, there's a certain aspect of this that as women, we're not being cared for adequately. And that's forced us to kind of take matters into our own hands, which is a double-edged sword because for period issues, we're all about doing it ourselves. But like if I have a toothache, I'm actually going to the dentist and I don't think twice about that, right?
Yeah.
I wanted to talk a little bit, we touched a little bit on endometriosis, and I wanted to kind of take this kind of, just kind of bring that back because I feel like the message after reading your book is very much like this is what we need to know about the pill. And these are the things that have been done. And there's been a lot of books written about the pill. And some of the research that you highlight in the book, really, like I stumbled across a lot of that research as well in my process.
Rabbit hole.
Rabbit hole. The 2-year like tunnel of writing. And I haven't really seen a lot of people talk about it. And it's very interesting because what I found, and I'm sure you found this as well through your years of practice as well as your research, it's not hard to find like tons of research. Like it's not like you're scouring the like depths of the internet to find one paper. There's like hundreds, like thousands of articles that highlight
since the 1960s
too,
like,
and even earlier that highlight the specific. And even what you said, it really astounded me that doctors are like, really? You're giving a multivitamin, and they're kind of questioning that. I was like, but there's all of these papers, anyways. So with that notwithstanding, when it comes to the pill, it's controversial to kind of talk about it for some reason, even though there is all this evidence. And I think really as more people start to understand it, we'll get past that. But when it comes to having this conversation with women, I'm sure you found it as well. A lot of women really, I mean, I live in Canada, so it's a little bit different here. We're a little bit more stable in terms of our access to things here. So a lot of women, it really is triggering because if we're talking out against the pill, there's a lot of women who have to fight for access to it. And then women who do suffer from endometriosis and have the terrible symptoms, in many of these women for their life experience, that is the only time that they've experienced some relief of their symptoms. And so it's kind of like, you want to take this away from me. So how do you address that? Because I think one of the things that has been occurring to me as this conversation continues is that like ultimately it's something, we need something, but women with endometriosis who are on hormonal birth control are still subject to the same side effects that we all are. So yes, we need that as like an interim solution, right? But we can't pretend like it's an adequate solution because it's not even a solution, right? So I'm just curious about your thoughts on all of that.
This is such a great point to raise because a lot of people want to view the world as black and white. And people have definitely tried to put me into like corners, basically, of like, your anti-birth control access to everyone. No. Your anti-birth control for any symptom management. No, not my body. Or, I've had other people too that are like, I cannot believe in your book that you are supporting women if they choose to take birth control. Like you raise all these issues and then you give them solutions like to stay safe on birth control. Like I can't even believe you would do that. Just tell them to get off. And I'm like, at the end of the day, I don't live in their body. And I think this is something that like, I had a really interesting childhood and then working in a homeless youth clinic with women like that really shaped my perspective of like, I don't live in someone else's body. I have no right to make that decision for them. They have all the right to have all the information and still choose to use hormonal birth control. If they want to use it for birth control, if they want to use it for symptom management, that's for them to decide. And in my practice, I won't tell a patient like, oh no, don't get this IUD. I'll go through like, here's what could potentially happen. Let's get you to chart your information, get your data. Then once you get it placed, continue to follow your symptoms. See if it's true for you that this is actually working or is it not working. So I think like a lot of people want to view it as black and white. And definitely women get triggered by this because they have been told that this will fix their problem. And that was something that like endometriosis, maybe they started the pill and they did get symptom relief. So they have bought into the idea that this has fixed the problem. And, for whatever reason, they get triggered by this conversation. And I definitely get women. It happens like on social media. We get it through customer service. I get nasty messages sometimes. It was a lot more as we were chatting before. 6 years ago, I would like put up a post and people would be like, you're the anti-Margaret Sanger, like you're anti-feminism, like you want to take away care to women. You're hurting every human on this planet. Like all this stuff that it was just like, that's not what I'm saying. But it's been, absolutely instrumental in the women's movement and our ability to graduate college at a higher rate. We were CEOs of companies now. Like, this has been a tool that women have used. So there's some women who are like, you know how hard we had to fight to have access to this, so that and you should be saying thank you, because, we fought for this so that all women can have access. That's why my book is dedicated to the women who went before us. It's also dedicated to the women who are questioning everything, because we should, it's 100% our right to have access to birth control, as it's 100% our right to have all the information so that we know how this might impact our body. There are absolutely women out there dying of stroke, and they're not 40. Okay. There are teenagers, there are 20 somethings. And in my book, I go through the hardest chapter for me to write was the metabolic chapter, the metabolic mayhem, because that's where I go through stroke, diabetes, heart attack, cancer. And I think we make a lot of decisions based out of fear in women's medicine. And there was even this, Medscape publication that came out where they surveyed doctors and nurses of who thought it was okay to lie to patients. And there was a large percentage of doctors who felt it was okay sometimes to lie to patients. And, some of that is okay, so you might be in the emergency room, you need to save this person. You're not going to be forthcoming about all the things because you need to save this person. Maybe, I'd always, this is my personality. I play the devil's advocate and I go both ways of okay, let me try to understand both perspectives and not be judging anybody, but with that, it's really interesting to me because there are women who have been told flat out lies by their doctor. And when I read that Medscape survey that they did with doctors, I was like, huh. And, these lies and I hate using that word, but it's not true. So that's what it is. But, are fear-based, and they're to push a woman into making a decision fear-based. And in my book, I didn't want anybody to feel afraid of starting birth control, being on it, coming off of it. I wanted them to feel like they had the information and that, they could have an educated discussion with their doctor. And so when you start talking about cancer and heart attacks and all of that, it's a hard line to walk because it's scary. It's a very scary thing to be, even thinking about as a woman. So in all of this, I think, where we need to be really taking this discussion is what is true for you? And really, I bring up the issue in my book of women with endometriosis. Why are they given the pill for heavy, painful periods? Usually the pain is the big thing. And they're told this fixes them. And where I really take an issue is that this could be passed to a 14 or 15-year-old girl, or young woman, I should be saying. You get to a certain age and then you start saying they're girls. And then you're like, when did I get to this age?
Totally.
And then I'm like, oh, I'm that lady now. But with that, it's fine if that's what you elect to get her out of pain, because how do we diagnose endometriosis? With surgery. No one wants to operate on a teenage gal's pelvis. Totally back that. That's invasive. But there should at least be the discussion of hey, we're going to use this pill. That's going to help get you out of pain. We should also get you over to someone who's going to help you investigate the root cause, work on all of that. If this persists, we should really keep tabs on you, because if this persists and that the only way that you can get symptom relief is with the pill, we need to investigate this in the future. And endometriosis should at least be on her radar as a discussion in all of this, because the research has shown, I think women with endometriosis and PCOS, all women get the short end of the stick, but these gals in particular, there's not been enough research being conducted. They're often dismissed and told that the pill fixes their problem. And, endometriosis is estimated to be 12% of infertility cases. So, and the younger you're put on the pill for these heavy periods and the longer you stay on it, the higher the probability is that you actually have endometriosis. Research has shown that. But now we've delayed the diagnosis, and a woman comes off the pill in her 30s thinking she'll get pregnant. And lo and behold, she's had this chronic disease that's been allowed to progress because the pill does not address the root cause of endometriosis. And for women who are listening with endometriosis being well, what's the root cause? We don't know yet because we haven't been doing the research, and it's lame. But what we do understand is that it's inflammatory. There's an estrogen dominance component to that. There's likely gut dysbiosis taking place, and there's probably an autoimmune component. And as I outline in my book, Beyond the Pill, hormonal birth control, it leads to intestinal hyperpermeability. That's how we get to autoimmune disease. It is inflammatory. It depletes nutrients. There's all these things that it does that could actually make, the endometriosis worse. But it's being masked. It's just being masked and numbed out. It's there's a painkiller on what's happening. And that's not to shame anybody or say like, oh, you did a bad thing if you use the pill. It's just to say like, that's fine to use it, but we should also be questioning and supporting that woman and making sure that all of this is on her radar. And, with PCOS, that's something I think is a really, I mean, I keep using the word disservice, but that's really like what it is that these women have irregular periods. That's one of the hallmark symptoms of PCOS is this anovulatory cycles. They're not ovulating. And with that, they're past the pill and then they have regular pill bleeds. And so their doctor's like, your period's fixed. Yay. Go on your way. Nobody's following up on them. And no one had the conversation that like, actually, you have a metabolic disorder that's rooted in blood sugar imbalances and inflammation. You're at higher risk of diabetes and stroke and cardiovascular events. And by the way, hormonal birth control is actually raising that risk as well. And we should be monitoring you. If you want to use it, that's fine, but we should monitor your blood sugar. We should monitor your inflammation. We should monitor your health. And also, let's get you eating well. Let's get you exercising. Let's get you doing all of this lifestyle and dietary medicine that will help you in the long run so that when you come off of birth control, if you do want to get pregnant, that like you have a better shot at that rather than just telling you everything's fixed. When you're ready to have a baby, we'll worry about it then. Because the other thing women get told is, here's the pill. And they come off, they end up with post-pill amenorrhea. They're having irregular cycles. Their doctor says, do you want to have a baby? No. Okay, go back on the pill. And when you're ready to have a baby, let's just go ahead and like, we can talk about IVF or we can go a different route. This happens in hypothyroidism as well. So it's very interesting to me that there was, guidelines that came out then, and the guidelines said, if a woman has a TSH of 2.5 or higher, and she wants to become pregnant, start her on a medication. Like that's considered problematic. But if she doesn't want to get pregnant, don't worry about it. Like, what is that? Like pregnancy is like the only determination to get adequate medical care in some of these situations.
Well, like the fundamental issue that I take with like all of it, I feel like how did we get, it's almost like this, I would call it like a crazy train of just like we're just completely insane and this train is just going crazy. But if we go back to the very beginning, what is the fundamental belief that allows this foolishness to occur? And the fundamental belief, from my opinion, is that, from this traditional medical perspective, no one is acknowledging that the menstrual cycle is an essential sign of health. Mm-hmm. And because it's like we've been reduced to our ability to procreate, to reproduce. So as a woman, that's it. That's our only role. And nothing else matters. And so it's exactly what you said. Outside of the time when we're trying actively to get pregnant, it's like your whole menstrual cycle, reproductive system, none of it matters. So like going back to the 14-year-old girl who has severely painful periods and is put on the pill from a very early age, it's a fundamental shift that needs to happen in medicine. We have to first understand that her periods are important. And that 14-year-old girl, she's going on the pill for period pain in our example. Putting her on the pill for 10 years is going to reduce the chances that she's going to develop full maximum peak bone mass in her lifetime, right? So if we can't get that the menstrual cycle is an integral part of a woman's health and that it's like, that's the first step. And it feels in many ways that we're getting closer, but it feels like we're so far away because nobody really questions this whole situation. And the reason that I was asking about the endometriosis example specifically is because, women with endo who experience pain, because not all women with endo experience pain. There's women with endo that have no idea until they try to get pregnant and they can't get pregnant and they've never had painful periods. But the women, they've been through the ringer. When I talk to women and I ask them about what their pain is like and they tell me things like it feels like someone was stabbing them. It feels like someone set them on fire. It feels like someone was like reaching into their abdomen and like gut wrenching them. That's horrifying. And so obviously, if you take a medication that makes that pain go away, obviously you're really going to be appreciative of that. But at the same time,
I was.
I was too. I had really painful periods and I've described it on the podcast many times. I felt like someone was reaching at my butt and doing this. It was horrible. And I appreciated it. But from a very young age, so like 18 or 19, I realized because I wasn't sexually active. I was taking it for the pain management. And so every now and then I would come off of it. And every time I came off of it, the pain would be back worse. And so even from a very young age, I knew that it wasn't actually doing anything, right? Because the pain was still there. So there's so many things that are missing. But we're missing that understanding that the menstrual cycle is an important indication of health. And we're also missing the conversation with young ladies about their future fertility, because although many of us are actively avoiding pregnancy in our late teens, obviously early 20s, it doesn't mean that we never want to get pregnant. And we need to be thinking about that. If a woman has endo, it doesn't mean she's never going to want to get pregnant. Putting her on the pill for all those years doesn't set her up for the best case scenario that she'll be able to conceive when she wants. Because one of the things I believe really strongly, it's not just that we should have access to birth control, but we should also have the right to have babies when we want.
Mm-hmm. Oh, yeah, totally. Well, I didn't have a baby until my 30s. Everybody in my family had a baby before age 20. And so by the time I got into my 30s, my family was like, she's just infertile. Like, there's just no way. Like, she's not having a baby. And so, no, I'm totally with you on that. I come from my mother's side is a large Hispanic family. And we joke that like, you just look at a Latina and they get pregnant. And so to watch like my cousins, my aunts, like everybody having babies as teen girls, and my mom had 3 kids before age 25. Like, I'm in my 30s. I have 1 kid. I'm like, I don't know how you did that. Like, that's amazing. I guess in your 20s, you have a little more energy, maybe. Like, I don't know.
I would imagine.
I don't know what to chalk that up to. Yeah, I think you're totally right about that. Like, we should, but here's the other thing is another issue is that the burden of pregnancy falls on us. And people hate when I say that sometimes because they're like, pregnancy's not a burden. It is if you didn't want to get pregnant. And, carrying all that, like that weight, that human, everything that goes into it, passing a big human through a very small orifice, like all of that is like no joke. And this is something else we're not supposed to talk about, right? I mean, that's really been so much of the issue. I think at the crux of all of this is we've been told to be ashamed of our bodies. We've been given the story that being a woman is inherently terrible, that you have to have a pharmaceutical in order to fix you, and that you're not supposed to talk about any of this. And it's something that always strikes me as odd when a research study comes out and it's validating what women have been saying for decades. Like the depression studies that came out in 2016, and how many people lined up everywhere to dismiss it, to say, this wasn't a very good study. And correlation is not causation. And it's like, at this juncture, that's old. Like, can we just stop with that? I don't need a study to believe my patient, and a doctor shouldn't wait for a study to come out to validate a woman's experience. And instead, we can go back, there's doctors that I mentor and they'll be like, oh, I need a study. I don't, there's no study that says that. And I'm like, you have the best data and teacher in your practice. They sit across from you and they tell you their story. But, when that study came out, and people were dismissing it and dismissing all of that, I'm like, women have been complaining about this since the introduction of hormonal birth control. Like, women who do not know each other around the entire world are all over the internet telling the same story, don't know each other, and having similar experiences. At this point, we need to stop questioning whether women tell the truth. And we need to start questioning, why is it that she had issues, but she didn't? What is it about her that made her, I think with the stroke risk and clots, that's an easier one. We know that if you have certain genetic variations, you're going to be at higher risk. We know why, okay, this is potentially why this 19-year-old girl has a stroke, but this 39-year-old woman who's still on the pill is not having any issues. That's where we need to start fine tuning and refining things, is getting that individualized lens on, and stop debating whether or not women are telling the truth about side effects, and start asking, why her and not her? What are the differences, so that we can do better, and we can, do better in medicine and counseling women. Women can do better in understanding their options. And in addition to that, we also need to start bringing men into this whole conversation. So I've also had women say to me oh, you just hate men in some posts that I do. It always cracks me up. I'm like, I birthed a man, right? And then I married a man. I live with 2. It's this two of them and one of me. Like, I'm not really anti-man in any way, but like, I'm trying to raise a boy who's body literate and period positive, and who, like, you know, he sees me having my period. Like, the first time he was like, what's all that blood? Like, what's happening? We got out an anatomy book and I took him through and I was like, this is the endometrial lining. This is what happens. And like, did he get it at 3? No, but here he is at 6 and we're still explaining it. And he will tell people like, yeah, like my mama's endometrium is shedding. Like,
That's
like,
awesome.
and it's something that, like, if we start having these conversations, we normalize it. Like, men have been taught, like, periods are gross and they're icky and don't talk about them. And like women, don't make men uncomfortable with talking about your period. But it's like, do you know why the whole human race is here? Like, an entire species exists because we bleed and we ovulate and we go through all of these things. And so it's really silly to me. I'm like, would you shame a dog on the side of the street? Like, when you see a dog pooping, are you like, shame on you? Like, no, you're like, well, that's a natural thing and gross. I don't want to step in it. That, like, we are taught as humans to be ashamed of everything that's just a natural process if it like could possibly make somebody uncomfortable. Now, having poop aversion probably saves our species. Like,
yes.
you know, so you're like, I'm gonna stay away from that. But it is something like you shouldn't be ashamed of these things. And you bringing men in this conversation, like we saw the male birth control trial that I talk about in my book, and how that was quickly dismissed because, you know, they like, you know, less than 5% of them had mood issues. Yet in the same quarter, an IUD was released where, you know, like a good chunk of women were having mood issues, but that was deemed completely acceptable for women. And it's because, you know, it's always been this, the burden of pregnancy lies on that woman, because if you don't want to be pregnant, you know, a man can always walk away. And like, I hate to say that, but that's so,
it is the
like,
truth, though.
They can walk away. It's your decision. And you've got a hard decision to be faced with. Like, no matter, like, I don't, you know, whatever you decide, that's on you. I don't think that anybody's beliefs should be put on you in terms of your decision. But in that's not, it's whatever that decision is hard. It's a hard decision. And like, there's psychological trauma that can come out of that. And so, like, of course, women are going to want to be on birth control to prevent all of that. But we're missing a big part of the conversation, which is like, you know, how do women get pregnant? There's ejaculate. Okay. That's like, that is, it's sperm. And there was someone who wrote a great article. She's like a Mormon mom of 4. And it was like one of the best arguments where she said it's irresponsible ejaculation that causes unintended pregnancies. And I was article. like everybody was tagging me in that. And I was like, this is like one of the most profound thoughts of my life.
Like, imagine what would happen, like, if men just like withdrew, right?
Yeah.
Like literally. So it's free. You could just pull it out, and like, it's not 100% effective, but up to 96. But it's like, you could just do that. No. And like, but I'm supposed to put myself at risk of like 11 billion different side effects that I'm not even properly counseled on by my practitioner. And that's okay. But you can't just like pull it out or wrap it up.
Yeah. Yeah, no, totally. And that's something that I talk about the pull out method in my book. And like, it does have, it's a 4% failure rate. Like, that's like with, you know, that's with perfect use. That's up there in terms of its efficacy rate. My thing is that, like, I don't like women not being able to be in control. Like, that's something you're totally not in control of at times. But it is something that, like, oh, why aren't we talking more about male responsibility in this? Like, why are men not counseled in how to properly use a condom and like the ins and outs of using a condom? Because people will say like, well, they don't totally work and they break. Well, that's male user error a lot of the times, because they're not putting it on properly. They don't understand lubrication, like, and they're not taught any of that to the degree that they really should be, because again, it's up to the girl to make sure she doesn't get pregnant. And like, I have a son, but I put myself in like the position of like, what if I had a daughter and she's a teenager? Like, I don't want her to get pregnant. Having a son, what can I do? My due diligence of teaching him about his body, how it works, about her body, how it works. And that, like, my husband's like, when we get to that stage, please, like, let me handle like talking about that stuff, because you are just way too like, put it all out on the table. Like, like I have the reputation of talking about the things we're not supposed to talk about. Yeah. My husband's like, let me like handle that like a little bit more.
I don't know. It's like, I have 2 sons, age 3 and 6. And you and I are probably similar in the things that because I mean, there's a lot of things. My sons run around, they know their names of their body parts. That's a whole other conversation. But I will have no problem telling my teenage sons, pull it out or wrap it up. Like, you know what I mean? And I mean, this is just crass tongue in cheek. But at the end of the day, I mean, the world will be different if we recognize that pregnancy isn't just a woman's issue. And we have to raise responsible young men with adequate education. We have this push to educate women about their cycles. Men need to be educated about the cycles as well. So I couldn't agree with you more.
Yeah. I want to say to that, though, that I was having a conversation with a woman in her 50s, and she's like, you know what was acceptable for men to say to us? It was acceptable for them to say, I don't do condoms. I don't do condoms. I won't do a condom. And she's like, and, you know, there were my friends who were like, okay, well, he doesn't use a condom. So like, and I want to be in a relationship with him. And she's like, and I never let that fly. But like, she was talking about how times are changing, because it used to be something where a man could say to a woman, oh no, I don't do condoms. That's not me. And I'm like, so you do chlamydia? Is that what you do? Like, what is that about?
Right?
Like, this isn't just about like getting pregnant. This is also about protecting everybody from spreading communicable diseases.
Well, yeah, I mean, absolutely. I grew up in the 80s and 90s, and I went to a Catholic school, and my education, and I know everyone didn't receive the same, but I was basically taught that I could get pregnant every time I had sex. And then if I did have sex without a condom, I would get AIDS and die. In the 80s and 90s, it was all about HIV. It's like they don't talk about that anymore. But I grew up in a time where condoms were effective. We were taught about them. We were taught how to use them, sort of. And we were also taught about the importance of condoms to prevent STIs. So these days, the climate has shifted. And so I'm always like, what about condoms? Like, since when did condoms become 76% effective? No, they're 98% effective when used correctly. So I recognize that we could talk forever. This has been super fun conversation.
Especially being kids of the 80s and 90s. There's like, I mean, we were the first generation to not know a world without AIDS. Like that is something that's like, it's astounding. Like, it's just astounding to me. And I think, I mean, to be talking to a woman in her 50s of a man of like, I don't do condoms. I'm like, you find yourself like a 30-something, 40-something-year-old man, and they ain't gonna be saying that.
No, not these days. No.
Yeah.
Well, we've covered a lot of ground. I feel like we had a really fun and informative conversation. What is the one thing you would want the listener to take away from it?
Oh, I think the biggest thing is that you have to believe your story and trust yourself. We are the only ones who live in our body. So you are the only person who can know what your normal is. And there are people lining up every day to dismiss you, and not even on the conscious level. That is very subconscious, to where, we see it around food. We see it around, so many things, and birth control is no exception. Your hormones is no exception, where there are going to be people who put their story on you and tell you that what you're experiencing is not true. You have to trust yourself. You know your body better than anyone else.
Love it. Love it. Fantastic words to end on. And I couldn't agree more. So, Dr. Brighten, this has been just fantastic. It was really great to finally connect. We're kind of like in the worlds beside each other, know a lot of the same people, some of the same friends. So it's really nice to finally be able to chat with you. Where can the listeners go to learn more about what you do, and of course to grab a copy of your book, Beyond the Pill?
Yeah, you can find me at drbrighten.com, DRBRIGHTEN. I'm also on Instagram at Dr. Jolene Brighten, and you can find videos on YouTube, because I know we all learn differently. Not everybody wants to read a 3,000 word blog post. I hear that. And so you can also find Beyond the Pill, anywhere that they find books. And if you pick it up, I've got some gratitude gifts for you at beyondthepillbook.com. You can get access to 5 exclusive interviews. Nicole Jardim is one of those, and including you can get recipes, you can get lab guides, and all kinds of goodies there.
Awesome. Well, thank you so much for being with us today. It's been a pleasure.
Yeah, thank you so much for having me. And I'm so glad we finally connected after knowing all the same people. But that's the journey of writing a book, right? We've both had our head down for 2 years.
Yes. I poked my head up and I was like, oh my goodness, Jolene Brighten, this is fantastic.
Well, awesome. Thank you again for such a great conversation, and for all the work that you do in the world to support women.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes for today's episode over at fertilityfriday.com/255. I hope that you enjoyed my interview with Dr. Brighten today. It was a treat to have her on the show and to jump into the pill and to really talk about not only the reasons why it's not actually a treatment and a solution to women's health issues, but some of the ills and issues surrounding it. And I really liked our discussion around, the medical field and why is it that our medical field is so focused on this as the quote unquote solution. And why is that actually problematic? I think that a lot of women out there don't really even appreciate why it would be problematic to suppress symptoms with the pill, because, the lies that we're told about the pill include, or I could say misinformation, to use a softer word. But essentially, most women still believe that when you're on the pill, you're getting your period, it's regulating the period, it's helping to make your periods easier and better. And it's actually a solution, kind of like a medical treatment for a problem, when really it's not a solution at all. It simply masks the underlying issues that are causing it, and it doesn't fix anything. It doesn't actually treat or fix any type of issue. And, most women want to come off the pill eventually at some point, whether it's for health reasons or whether they're ready to start their families. And so whatever the issue is in the background is still there. So, the pill gives like a false sense of security, helping you to believe that you're actually doing something about the problem when really you're not actually doing anything about it at all. So I really did appreciate our conversation today. And I also appreciated going into the topic of feminism. And I thought it was really interesting, when Dr. Brighten was talking about her experience when she first started being outspoken about birth control. And, it's a different time now. We've definitely made some progress, but, I really resonated with what she said when she said, when she first came out with this, people weren't that receptive to the idea of questioning the pill. And, I think that there's a distinction to be made. So questioning the pharmaceutical drug that is associated with a ton of side effects that can be detrimental to your health is different than questioning the right as women that we have to access birth control methods and the right that we have, or at least should have, to control the size of our family. And I think that is the real important distinction. We are in a different time. A lot of us are focusing on our health. We're trying to eat better. We're trying to exercise. We're trying to look at our lifestyle factors and do all of these positive things. We're trying to eat organic and often looking for non-GMO foods and all of these types of things that we're trying to do overall to improve our overall health. We can acknowledge that there's a fertility issue, a growing problem where more and more couples are struggling to get pregnant. So all of these things are related, So we're starting to wake up and recognize that what we do to our bodies, how we eat, how we live is affecting our health. And so that puts the pill right smack dab in the middle of this conversation, because we're trying to avoid all these chemicals and, hormones and all these things, yet still we're putting hormones in our body every single day and we're not really aware of how those hormones are affecting us. So I really appreciate that conversation around the feminist aspect, because I know, through and through in my bones that I'm a feminist. And part of that means that I believe that we have the right to informed consent. We have the right to know exactly what we're putting in our bodies, what the side effects are, so that we can make choices. And I always say, like, when it comes to birth control, women, once we know what the side effects are, once we have that full disclosure, then we can make choices. So some of us are going to choose to continue using it just like we would for just as long. Some of us are going to choose to lay off of it for a while. We might use it for a season in our lives. So there might be a few years where the pill is, the perfect solution to the issue. If we know about the side effects, if we experience those, we could kind of moderate our use, try something different, etc. But at least we have that knowledge and power to make those decisions for ourselves. And then, there's another group of us who are going to say, like, that's not for me. That sounds just too much. And I don't want to put those hormones into my body. And that's fine. But at the end of the day, we have the right to choose. And that's what feminism means to me. That's what it means. It means so that we are able to make informed decisions. And part of that aspect of what feminism means to me is that when we're ready to have kids, it means that we can do that and we have the choice to do that. And we have all the information that we need to optimize our chances of conceiving easily, having a healthy pregnancy, and really healthy children. And so part of my issue with birth control is that it does have an impact on fertility, though temporary. The research tells us that. And, we spoke about that in last week's episode. So if you didn't get a chance to catch last week's episode, I was sharing the top 5 ways that fertility awareness can help you to prepare for pregnancy. And one of those ways is by avoiding hormones. You're actually preserving your fertility, allowing your body to cycle naturally so that when you're ready to have a baby, it's easier, potentially. You're increasing the chance that it's going to be easier for you to get conceived. believe. And so I think a big part of this whole concept of feminism, what it means to be a feminist, in my mind, the majority of women I meet want to have a child at some point. Now, not every woman wants to have children at all. And not all women are decided on that, or when or if. But at the same time, a lot of us do. And so a big part of feminism has to make room for the fact that many of us do want to have children, and we want to have them when we want to have them. And we want it to be, a healthy, natural process when it's time. And from what I see, the birth control pill and other types of hormonal birth control can make it more challenging, just depending on the situation, depending on how your body responds to it. And we just need to have that information. That's what this is all about. You just need to have access to this information so we can make informed choices. So with that said, a long post-amble, I was going to say preamble. I don't know if that's an actual word, but I just made it up and I think that's totally fine. But anyways, I just wanted to share some of my thoughts with you after this interview. And, I just want to thank you for hanging out with me today, for taking the time to tune into the podcast. I appreciate all of you for spreading the word about Fertility Friday, sharing it with your friends. I see you out there on social media, tagging your friends. And, I hear all the time, oh, my friend told me about this episode, or my sister told me about the show. And so I really appreciate all of you out there sharing this information, spreading the word, because this is really how we make an impact. I believe in the power of this kind of grassroots uprising of women taking control of their fertility, learning about the connection between the menstrual cycle and overall health, learning about, the side effects associated with birth control, whether you have experienced them personally or not, so that we can all be more informed and make better choices that preserve our health and our fertility. And of course, this is something that I talk about in depth in The Fifth Vital Sign. If you haven't had a chance to grab it yet, it's available on Amazon in paperback and ebook format. And you can also grab the first chapter for free over at fertilityfriday.com/vital sign. That's fertilityfriday.com/vital sign. And so with that, I will let you go. I hope you have a wonderful week or weekend or day, wherever you are in the world, and whatever you're doing while you're listening to the episode. I appreciate you taking some time to hang out with me today. And of course, as always, until next time, be well and happy charting.